Antibiotic prophylaxis in surgery. Antibiotic prophylaxis refers to the administration of antibiotics in patients to reduce the risk of perioperative sepsis. The main cause of morbidity and mortality in surgery is infectious complications. Antibiotic prophylaxis is indicated in cases where sepsis is expected and could have disastrous local or generalized effects. For prophylaxis to be effective, antibiotics must be given before contamination takes place, or at least the earliest possible time before infection is established. For surgery, therefore, it must be given IV about the time of the induction of anesthesia so that tissues are saturated with the antibiotic before contamination occurs. The causes are Staphylococcus aureus, Streptococcus species, Enterobacteria or Enterobacteriaceae, also anaerobes, and that's GI, and coagulase negative staphylococci, especially cardiac surgery and implantation surgery, among others. Main treatment objectives are to prevent infections and prevent complications. Indications, so proven indications are acute appendicitis and intestinal obstruction, surgery on the colon and rectum, surgery on the biliary tract, gastroesophageal and oropharyngeal surgery for carcinoma, hysterectomy, surgery in the presence of pus, patients with rheumatic heart disease and patients with congenital heart disease. Accepted indications are implant surgery where prosthesis and device implants used, and cardiovascular surgery and cesarean section. The possible indications are thoracic surgery, neurosurgery, surgery on the genitourinary tract, and trauma surgery. Let's look at the choice of antibiotics. So the antibiotic chosen must have antibacterial activity against the anticipated pathogens, and not easily induce antimicrobial resistance, and have a high concentration at the site of infection, be safely metabolized and excreted, and have few toxic and adverse reactions, and also be affordable. Okay, so more on the choice of antibiotics for prophylaxis. The surgical procedure and the regimen for appendicectomy or uncomplicated appendicitis. If the regimen is ampicillin and metronidazole, ampicillin IV in adults 1 gram, in children 6 to 12 years 500 milligrams, less than 5 years 250 milligrams, and metronidazole IV in adults 500 milligrams single dose at induction of anesthesia, in children 7.5 milligrams per kilogram single dose at induction of anesthesia, or metronidazole rectally in adults 1 gram 1 hour before surgery, and in children 125 to 250 milligrams 1 hour before surgery. Also, resection of the colon or rectum or obstructed bowel. The regimen gentamicin and metronidazole. Gentamicin IV 5 milligrams per kilogram, and metronidazole IV in adults 500 milligrams, in children 7.5 milligrams per kilogram. Or metronidazole IV doses the same as I mentioned, and cefuroxime IV in adults 1.5 gram, in children 60 milligrams per kilogram as a single dose, or ciprofloxacin IV to be administered over 60 minutes, in adults 400 milligrams 8 to 12 hourly, and in children 10 milligrams per kilogram 12 hourly, and a maximum of 400 milligrams, and metronidazole IV in adults 500 milligrams stat, and in children 7.5 milligrams per kilogram stat. And also biliary tract surgery, regimen gentamicin and cefuroxime. So single dose of gentamicin IV, the same as I mentioned, and cefuroxime IV. For hysterectomy, single dose of metronidazole IV 500 milligrams. For dental procedures for patients with heart valve prosthesis, rheumatic heart disease, septal defect, and patent ductus arteriosus. So, under local anesthesia, you give amoxicillin oral in adults 3 grams 1 hour before procedure. In children 6 to 12 years 1.2 gram, 5 years 750 milligrams. In patients with penicillin allergy or who have received more than 1 dose of penicillin in the previous month, you give clindamycin oral in adults 600 milligrams. In children 5 to 10 years, give 300 milligrams. Less than 5 years 150 milligrams. In patients who have had previous endocarditis, in adults, give ampicillin IV 1 gram and gentamicin IV 120 milligrams at induction, and then amoxicillin oral 500 milligrams 6 hours later. In children, give ampicillin IV 6 to 12 years 500 milligrams, less than 5 years 250 milligrams, and gentamicin IV 2 milligrams per kilogram, and then 6 hours later amoxicillin oral 6 to 12 years, give 250 milligrams, less than 5 years 125 milligrams. Under general anesthesia, give amoxicillin clavulanic acid IV in adults 1.2 gram at induction, and then amoxicillin oral 500 milligrams 6 hours later. In children 5 to 10 years, give half of adult dose. Less than 5 years, give 1/4 of adult dose. And if the patient has a prosthetic valve or previously had endocarditis, ampicillin IV and gentamicin IV. The patients who are allergic to penicillin or who have had more than a single dose of penicillin the previous month, you give clindamycin IV in adults 300 milligrams over at least 10 minutes at induction or 15 minutes before procedure, and then clindamycin oral or IV 150 milligrams 6 hours later. In children 6 milligrams per kilogram start and 3 milligrams per kilogram 6 hours later.